Hello viewers, I'm Dr. Arshad Joya. I'm consultant orthopedic surgeon, and we are discussing the Lodge and Hansen classification system for the ankle injuries. In this video, we will discuss the second type of this classification, which is supination and external rotation type of injury. This describes that the foot is fixed in inversion or supination and external rotation force is applied on it that results in avulsions of the ligaments or tear of the ligaments and fractures around the fractures around the ankle joint. And this type of injury has 4 stages, and this injury runs from lateral to medial in clockwise direction. In describing its 4 stages, first stage is the tear or rupture of the anteroinferior tibiofibular ligament when the foot is in supinated direction. The first stage is there is tear or avulsion fracture of the anteroinferior tibiofibular ligament from its attachment sites. If there is avulsion fracture from the anterolateral distal tibial attachment, then this fracture is called Tilloch's-Chopard fracture. Or if there is avulsion fracture from the fibular side, this is called Wagstaff-Lee-Ford fracture. When the injury continues in lateral direction and reaches the distal fibula, then there is fracture of the lateral malleolus at or above the syndesmotic level from anteroinferior to posterior direction. This is a short oblique type of fracture, and it produces a posterior spike on the lateral X-ray of the ankle. And this is the hallmark of this type of injury, that the lateral malleolus is fractured from the anteroinferior to posterior type of injury in a short oblique fracture pattern, creating a posterior spike on the lateral X-ray that differentiates it from the pronation abduction type of injury, in which there is lateral comminution, and there is no comminution in this type of injury. This can also be differentiated from the pronation external rotation type of injury, in which the direction of the fracture pattern is reversed, and that creates an anterior spike. And in this type, there is a posterior spike which is seen on the lateral X-ray. When the injury continues further, it reaches in the posterior malleolus, and there is tear or avulsion of the postero-inferior tibiofibular ligament, which is also called the Volkmann fracture. This is called Volkmann fracture. When the injury continues from the medial side, there is transverse fracture of the medial malleolus. Now these are the 4 stages, and the hallmark of this is short oblique fracture or the lateral malleolus, which can be seen on the lateral view with a posterior spike. Thank you.